Genetic testing, molecular testing, those are two tests in the diagnostic area and one of the fastest growing areas in the healthcare system today. I'm here sitting with Matt Zubiller, who is with McKesson Health Solutions. And Matt, when would it be appropriate for a patient to get a molecular test or a genetic test?
Well, that's a good question, and most folks don't really know today. Providers can't really tell, and nor can health plans really understand when is the most appropriate time to have a test. And there's just not a lot of evidence and data out there. However, these tests can have a really big impact on a patient's life. So choice of chemotherapy, the financial impact, just how much it's going to cost for that chemotherapy or that surgery. And so our goal is to help find a better choice, to be able to make a better choice with the right evidence-based decision-making criteria.
They seem quite complex, so I would think paying for them becomes quite complex. How is the industry dealing with that today?
Well, it's interesting. The industry today is already fairly complex in trying to pay for care, and this only adds to that complexity significantly. Today, molecular and genetic testing, there's roughly 2,000 of those tests, and there's about a handful of CPT codes, procedure codes that represent those tests. And so, for example, when a health plan tries to understand how many tests they've paid for, or a provider tries to effectively bill for those tests, it becomes very murky, it becomes very complex. And so, add on top of that, a $1,000 test may be impacting a $40,000 cancer regimen. It makes it very difficult to even price what those tests should be.
Okay, so what's the way forward from here then? What do you envision happening to make these easier to understand, find out who needs them, and who's going to pay for them?
Well, I think it's about providing decision support at the point of care. Being able to provide clinicians, physicians, and patients the information they need to make better decisions. So answering the question, is this appropriate? Is it covered? How much does it cost? Where can I get it done? And how does it impact the rest of my care really needs to be at the fingertips of the clinician and the patient. And so I believe the way to resolve that is to create a system, a decision support system, that enables and answers all those questions.
And who would really spearhead that effort?
Well, as McKesson, we're doing a lot of that work today. It needs to be an industry collaboration, so we need to see a shift, as I think we already are, between the role of the health plan and the role of the provider and the role of the lab. So in a diagnostic space particularly, today it's kind of broken because a provider will order a test, a lab will conduct it, then a health plan will basically figure out how to pay for it. The reality is that the health plan may not cover that test. The provider may not know that. And the health plan is the lab is caught in the middle trying to get reimbursed.
Right.
And so it really requires a system collaboration with labs and health plans and providers working much more closely together than they do today.
So with all that's being done with innovations and really trying to advance some of these options that people have at their disposal, is it difficult because we don't have the system to really support the use of these very complicated and useful tests?
Well, it's interesting. We don't have the system. It is very difficult, but I'd argue there are probably three major premises that we have to work on. One is that we need to be able to identify the test. So today, the coding system is broken. So if we can have a coding system similar to what we have in pharmacy, something called an NDC code, a National Drug Code, if we use that for a lab, then we'll be able to uniquely identify that test. Two is that we have to have a catalog, one place where we can identify that test, and that it can house information and evidence about that test, utilization data about that test. So it's one place that a provider or a health plan or a patient can go to find out more. And then third is a decision support system. Again, I think being able to answer those questions around, is it appropriate, is it covered, how much does it cost, and where can we get it done? Having that code, along with that set of catalog, as well as the system in place that connects providers, plans, and labs, is really, we believe, the way forward.
Are you at McKesson somehow limited in what you can do because we don't have really those kinds of functions in place today?
I think we are limited today, and I think some of the solutions that we're building can actually help to overcome that. So, for example, we'll go to a health plan today, and we can take all of their claims data on molecular and genetic testing and analyze that to produce a view of what their utilization may look like, but it's still very murky. It's better than what they could do on their own, we believe, but it's still very murky because there isn't a code. There isn't a set of information that claims data has today. In fact, because of the coding, among other things, a health plan can't tell which tests have been done, how many, who performed the test and who ordered the test. So if you don't have that data, how can you measure the problem and then manage it?
Right. Okay, Matt, is there anything that I've missed that we should talk about today?
Well, other than we're really excited to work with the industry around this. I think we have an opportunity to shift as healthcare is shifting, where reimbursement is moving from a volume-based process to a value-based process, where today you're paid on a fee-for-service model, and in the future you're going to be paid based on episodes and based on your performance. That if you have a system that tracks what utilization looks like, if you're able to connect plans with the providers who are conducting that care in a very transparent way in terms of what utilization looks like and what that diagnostic test is, then I think the system will benefit. And we can better manage the way we're spending our care to improve the total quality as well as the total cost.
Are you finding that payers and providers are welcoming your input?
Yeah, actually, some of the solutions that we have, for example, with Clear Coverage is one of our solutions. That is that decision support system I talked about, as well as the coding. We've also created a coding mechanism to be able to define those tests, Z codes, as well as a catalog itself, a registry for all these tests. So the feedback we've got from health plans is that they're excited about this, and they want to be able to see how they can then translate that into better relationships with their providers. Labs are excited about it as well. And I think matter of time in terms of working through those challenges to get us there and help make healthcare better.
All right. Matt, thank you so much.
Thanks, Mabel.
I'm Mabel Jong at the World Healthcare Congress in Washington, D.C.